The FDA has just given emergency approval to a coronavirus antibody test that is said to have 100% accuracy. Now, this test can determine whether or not someone has been infected with coronavirus. But what does antibody testing really mean in the fight against this virus and in opening up our economy once again? To answer some of those questions and more for us is Dr. Nidal Elbaridi, director at the Loop Medical Center. Doctor, thanks for joining me this morning.
Good morning. How are you?
Good. It's so great to see you. And I think, we keep hearing antibodies. That's the key to opening up our economy. But before we get into that, let's start with this new test from Roche. First of all, it is said to be 100% accurate. Tell us how this works.
So the most important thing to understand in terms of diagnostic testing is that we have two different types of tests. We have what's called a molecular test and a serological test. A molecular test is usually given to people who have had either an active manifestations of an infection, and it's done through some sort of a respiratory panel. And the way that this is currently being done, as your picture shows, is through a nasal swab, which then is placed inside a medium sent to laboratory for the analysis, upon which a test reveals whether the person has been exposed to a virus or not. The serological test, or the test which comes by analyzing the blood, is the other type of test that has been mentioned in the news quite a bit, and it delineates whether a person has had an exposure in the past. In order for this test to be administered, someone must not have any kind of symptoms associated with an active infection, meaning no fever, no difficulty breathing, no shortness of breath. So an understanding of whether the person has had a viral pathogen in their blood is usually done by what's called an antibody development within the blood. In other words, there's a type of a protein in the blood that raises up in level whenever we are exposed to some sort of an infection. And then it tells us whether that antibody or the protein is actually associated with what's called past exposure or the current exposure.
Okay, let me jump in here because so the antibody test is going to tell us if we're infected. So this breaking news now is that this new Roche test is out. It's 100% effective, which is incredible. What difference is this going to make if we all get tested for antibodies, those of us who thought we might have had coronavirus? What difference is this going to make in getting back to work and opening up the economy? Because our leaders keep telling us that this is key. And I find it interesting, especially considering now that we know that maybe once we've had corona, does not necessarily mean we won't get it again. In fact, we won't necessarily be immune. So why is this test so important?
Well, it's a great question. First of all, the antibody testing is already being done. So this is not necessarily a novel test. The Roche diagnostic test is attempting to create a much larger scale production with increased speed. And as you said, the accuracy of this test is being deemed to be close to 100%. So there are very important things that we have to discuss when it comes to the word accuracy. There is also this term that is commonly thrown in when we describe this, is called sensitivity and a specificity. In other words, does this test indeed confirms that there has been infection associated with this, and does it confirm all the time? And then is it exactly the test that is being used for this? So the current antibody testing processing takes about a day to 2 days in order for a client to find out whether they have been infected. This is exactly what we're doing in our clinic. The Roche is attempting to essentially bridge that gap, and it can produce hundreds of thousands of tests per day and provide a necessary information that would basically give us as a society a much faster way of knowing whether we have been infected or not. And as you said, it's exceptionally important to alleviate fears from not only our patients, but all of us who are working in the healthcare industry, that we can resume to the life that once we have known as normal.
But I have to ask you, though, because I want to go back to what I was really asking, which is, if we've gotten coronavirus once, we're now learning we could possibly get it again. why do we need an antibody test if it's not going to make us feel better knowing we can go back out into the world because we could get coronavirus again? Do you understand what I'm saying? I'm a little
I understand.
Yeah.
100%. And, I've created a little chart over here that kind of describes some of these things. But suffice to say that this is a quote unquote, a new virus that we have not encountered in the past. And this is exactly the sense of importance and urgency that we in medical community have had. So most of the viruses go through what's called a genetic shift. This is why whenever we give person a flu, we're actually giving them shedding of a coat from the year prior. So today's, or rather next year's vaccine for flu, if you would take that for an example, going to be viruses that are active in today, in other words, in 2020. We do not know what exactly is going to be the genetic shift that SARS-CoV-2 or COVID-19 is going to go through. So we believe that knowing about the antibody present today is going to give us good enough immunity. But obviously, based on the molecular principles and virology principles, we cannot say with 100% certainty that having an antibody for the virus that is present today would give us an immunity for the virus that will be present next year or so.
Okay, but you have clarified that very well. That's what I was curious about. Thank you so much. Now, Brittany is standing by with a question for you. Brittany, go ahead.
Good morning, Brittany.
Yeah, I think good morning. As these tests continue to come out, I think a question on a lot of our minds is where can antibody testing be done and how much is it going to cost?
I'm so glad that you asked this question. We have addressed that actually very important question multiple times in our social media. If you go to loopmedicalcenter.com, we actually urge all the practitioners and all the providers not to upcharge people for this very important test. We're on a public front, and all of us as a community need to believe in the sense of greater urgency, not to monetize this problem. So the Coronavirus Antibody Act has been passed by the Congress and offers an emergency funding to literally test every single person that is in the United States. So what we try to explain to the sheer public is that we in our office, we do not charge anything outside of what the insurance pays. And it is my understanding that most of the insurance companies, including CMS, Aetna, Cigna, Blue Cross Blue Shield, have actually dropped copays associated with testing. So it is super easy. If somebody goes, for example, in our case, to our website, loopmedicalcenter.com, and books an appointment, they can immediately schedule for the desired time a test. And once they come in, provided they're pre-registered, they can get testing in and out within 5 minutes and then go back home and then check on the portal of the results of this test. If a person does not have an insurance, we will gladly accept them. And we believe that this is very, very important public gesture so that we can essentially come to terms of moving forward as a society and improve our chances of getting back to our earlier lives.
Okay, Dr. Nidal, thank you so much for explaining that, because I think a lot of people are asking that question. And again, you are with Loop Medical Center. We appreciate your information. Everybody's trying to figure out what is our next step, and this is definitely one of them. So thanks for joining us this morning. We appreciate it.